On this edition on Able and On Air, what if you go into private practice to be a psychotherapist? The things you need to know and how to work with the public. We meet Jim Puglisi of Lifemap Counseling to discuss issues such as suicide prevention and other topics. All that and much more. Plus we meet his team of Lifemap specialists. All that and much more when Able and On Air starts right now.
Thank you, Lawrence. Thank you, Arlene. Thanks for having us.
Okay. Why don't you guys introduce yourselves?
Okay. I am Elizabeth Daniel, and I'm a psychotherapist at Lifemap Counseling, and I work with a variety of ages from very young children up to adults, couples, families.
Okay.
I'm Megan Damaris. I typically focus on working with teenagers and their parents, but I do meet with other ages as well.
I'm Chris Henderson, and I work with children, adolescents, and adults, and I focus on working with people who have stress reactions like depression or anxiety mostly. I do also do some work with folks who have autism spectrum disorder and working with some communication skills, that sort of thing.
Okay.
Hi, I'm Jim Puglisi, and I'm a licensed mental health counselor in the state of Vermont, and I work with people from early childhood all the way up to elders, all the way through.
Okay, what are the missions and goals of Lifemap?
Well, I think our primary mission is to deliver high-quality mental health services and meet people where they are in our community.
When you say meet people where they are, if they can't come to your office, you go to them.
People come to our office. So although we do have some school-based services, so we have several clinicians who actually go to schools and work with children in the school setting.
What exactly, so everybody here has their own specialization, right?
To some extent, yes.
What do you specialize in exactly?
Before I was a mental health counselor, I was a teacher and a special educator. So I have worked with children and parents for a number of years. And then bringing in the mental health piece really sort of brings that together to help parents with different parenting skills, also to help children to navigate the challenges that they may be going through at school. Then I also am trained in a therapeutic technique called Emdr, which is eye movement desensitization reprocessing, which really helps to take trauma memories that are current or from the past, such as people who are living with PTSD, and it helps to reprocess those memories and desensitize the emotional sting that those memories have, really bringing them some relief of the emotional challenges they're having there.
Okay. What do you specialize in?
So I focus on teenagers and their parents and sort of their families, and the issues that I typically see or come across are anxiety, depression, self-harm.
I'm going to backtrack since you say teenagers.
Yes.
And anxiety. We're going to backtrack. There's a lot of things that teenagers go through. I have a zit, you know, zits and puberty, and more often, you know, I must look good to be in a swimsuit. If they see a skinny person, they want to look like that.
Oh yeah.
You know, eating disorders is a big thing. Bulimia, anorexia. If you want to explain what those are and how would you treat?
Sure. So bulimia can come in a couple different forms. So there's a bulimia where kiddos will binge and just eat, and then they'll make themselves throw it all up. Then there's a form of bulimia where they'll eat and then they'll just make themselves throw up. There's another form as well where they'll eat and then they'll exercise and exercise and exercise to a really excessive point where they burn off just everything they've eaten. Anorexia nervosa is classified on a couple different levels. So in order to be considered anorexic, you have to be under a certain body percentage and body weight, and that has to be diagnosed by a medical doctor. It's accompanied by severe restriction of food, so there's like next to no intake of calories.
Okay, and since we said that, there's also another eating disorder called pica or pica, the excessive eating of inanimate objects, nails, paints, deodorants, tires, you name it, they'll eat it. Would you counsel or have you counseled someone that has had that?
I've seen some really minor pica before. It was
and there's also Prader-Willi, which is another one.
Yes. I have not seen Prader-Willi's, but I have seen some very minor forms of pica, and both of them had a medical basis behind them. So I actually referred that out. So I worked with those clients on the mental health, and then with the eating, it went to like a doctor.
Okay.
Yeah.
For those that don't know what pica is, why don't we take a look at, there's a show on Lifetime Television called My Strange Addiction. Let's take a look at some of those clips.
My name is Bria. I'm 19 years old, and I'm addicted to eating sand. I just love the crunch. It's always good on top of food, like a seasoning or something. I've taken a tortilla chip, dipped them in sand and ate them, and it gave the chip the best crunch that I've ever got in my entire life. My favorite combination of sand is when I mix it with gum. It's just like mouth-watering.
Okay, so what else, being a teenager, what?
Have you heard of some teenagers like inhaling some fumes that they inhaled Epsom salt?
Epsom salts, airplane glue, that type
all kinds of
I haven't seen any kiddos that have inhaled like spray paint or glue or doing bath salts or things like that, which, oh my goodness. I have come across, like marijuana is really popular with teenagers, experimenting with drinking and alcohol. You'll see things like K2 on occasion, which is a synthetic form of marijuana, can actually be much more dangerous.
CBD, CBD?
K2, which is
K2.
It's a synthetic marijuana.
Yes.
It's also called spice.
Yes.
Oh, okay.
Actually, this week there's a series of overdoses because there's bad K2 going around. But yep, so that's been in the headlines.
That certain breakfast foods contain weed. I was like, what?
Yeah. So,
Pretty weird.
how long you been in the field?
So I've been working with Lifemap for about 4 years. It'll be 5 in May. I've done a lot of internships. I worked at the state inpatient acute hospital for a little while. So I've been around for probably 8 years. 5 years as a therapist, though.
Does everybody in this group, would they deal with families? Mother, father, sister, brother?
Yes.
Or individual counseling? How does that work within the family?
Part of our orientation at Lifemap, we have 7 full-time clinicians. So there are 7 full-time folks. And each of us, I mean, even though we're all under kind of the same theoretical underpinnings, you know, we all do cognitive behavior therapy, we all do motivational interviewing, we're all person-centered. But we will oftentimes collaborate with each other. So if a family comes in, sometimes there'll be need for one specific person to have their own individual counselor. We'll put them with that person. Sometimes we'll do couples counseling with another therapist. So we have a family-centered approach.
Let's talk about suicide prevention and Ptsd, which is 2 real good topics that we've done things with Washington County with. Ptsd. Have you counseled now things like Afghanistan, Iraqi war, veterans, 9/11, things like that. Have you counseled people? And for those that are watching at home, what is some advice that you can give for those with PTSD?
Well, I think the first bit of advice is always hope. You know, PTSD is very isolative, and oftentimes people kind of hold that and feel as though they have to contain it. They don't identify it as an issue that needs to be shared with anyone else. So there's hope, and other people understand. And
according to the definition, there's a book that psychotherapists use. What is that book called? The
DSM, the
DSM.
Diagnostic and Statistical Manual.
Yes, according to the DSM definition, what is post-traumatic stress disorder, or what is?
So it's exposure. It happens when there's exposure to an event that is seen as life-threatening and perceived as life-threatening, typically an extreme event, oftentimes. And it manifests in symptoms of anxiety, depression. It can go hand in hand with substance abuse.
Would OCD be considered anxiety?
OCD, obsessive compulsive disorder, is an anxiety disorder, but it's not part of post-traumatic stress disorder, so we differentiate. So, post-traumatic stress disorder, panic attacks can be associated with PTSD, suicidal thoughts.
What is a panic attack?
A panic attack is when you feel as though your emotions have taken over, I think, when you get strictly into emotion mind. And it can, you can have pounding in your chest, maybe chest pains. I just touched my microphone. Chest pains, racing thoughts, feeling like you might be having a heart attack. Those are some of the things associated with it.
Breathing?
Yep, trouble breathing. So, am I missing any symptoms around PTSD and panic attacks? Flashbacks.
Paranoia.
Yep. Yep.
And vigilance. Hypervigilance.
What type of counseling do you handle?
I work with people who have PTSD or have anxiety or depression. So I have worked with a number of folks with PTSD.
Okay. In terms of suicide prevention, that's a big thing. Washington County had Suicide Prevention Month. Is it now? Why do you think? Is there a reason why people might want to commit suicide? And if so, how do you, with suicide prevention, how do you guys deal with it in your counseling?
Well, we oftentimes are referred people who have come out of an intensive stay at the, say, CVMC, and those sorts of things, and it comes on our radar after someone has reported it or it's been noticed. Sometimes it's a family member, and sometimes it's coming from another practitioner, a primary care physician, or someone referring from the hospital.
We work collaboratively, so with a variety of different agencies in the county and outside of the county to coordinate care. So depending on the acuity level, the severity of the symptoms, and
Now, what type of, in terms of symptoms, what are the symptoms of someone that wants to commit suicide, and how do you because I know being psychotherapists, you guys need to be what they call mandated reporters, where everybody has to, for example, if which I'm not, but if I want, today I feel like killing myself, you would ask me questions.
Yes. We would have a conversation with you, and we would actually have a conversation with you when we start the therapeutic relationship and talk about if you are having thoughts or feelings of harming yourself. and that we would work together to get you the support you need. That we really want you to be able to feel safe and comfortable talking about those thoughts so that we can work with you so that you will be safe and that you will not follow through with those. And that's something that I think all of us continue to listen, but also bring up periodically so that it doesn't become uncomfortable for the client to talk about, yeah, I have been having these thoughts, and then, okay, so let's talk about, are you thinking of acting on these thoughts? Let's talk a little bit more about it so that the conversation doesn't feel so uncomfortable, and that they know that this is somebody that's going to actually support them through it and walk through those difficult thoughts to get out to the other side.
Okay.
And we are specifically looking for several kind of markers when we're doing an assessment for safety. We're looking for, does somebody have what's called suicidal ideation? Are they having suicidal thoughts? Is that something that's going through their mind? How
What
often?
exactly is suicidal ideation? I'm sorry.
That's the definition.
Go ahead.
Are they having suicidal thoughts? Thoughts that I'd rather not be here, thoughts that I'd rather be dead.
Imagining.
Imagining it.
Or
So
for
then
example,
that goes into planning.
For example, if kids, because I know this was a big thing way back, if kids used to see, if children used to see, let's say, Christopher Reeve as Superman, they think, oh, I can have a cape, and there's been certain cases where kids put on a cape or a towel, and they go out the window, they think they're Superman.
So that's a bit different.
That type of thing.
Yeah, that would be more of a spontaneous action rather than a planned one. So, and then there's the piece of intent. Are they intending to harm themselves?
Exactly.
So the warning signs for suicide prevention are, some of the warning signs for depression, and then you want to explore that a little further to see if there's any history of the suicidal ideation, the thinking about, it will just be better if I'm not here, or people will finally think about me if I'm gone, or that kind of thing. If someone's giving away their belongings, that's a red flag. History of self-harm, isolation, self-deprecating statements.
Notes, putting things online, posting online.
There's been a lot of that.
Facebook,
Loss of hope.
So when you use it, like, oh my God, why are they doing that?
Facebook and Instagram.
Do they want attention?
Yeah, do people do it for attention?
Sometimes, but I think we have to take every single situation seriously. Sometimes people want attention and they do actually complete suicide.
Now,
so they need intervention, they need help in those situations.
Okay, now let's go on a little bit of a different topic, because we have lots of time. But, people with physical, mental, and intellectual disabilities. Do you counsel people with special needs, and how so within your, because I know you deal with people with mental challenges, but if someone comes to you like, oh, I'm in a wheelchair, but I need to speak to somebody because I have a lot on my mind, because I have physical challenges, and how would you counsel that person, or is there services within your?
I think we treat them about the same as we would anybody that walks in our door. We're all human. We all suffer. We all feel. It doesn't matter if you have a physical limitation, or if you have cognitive limitations, or like a traumatic brain injury. We all feel, and some of us feel more intensely than others, and each person has different struggles. So if you have a teenager who has a learning disability and they have to be in a different classroom, there's a lot of things that come with that. Their confidence takes a hit. They have a hard time keeping up in class, and so that can cause things. Somebody in a wheelchair, they may have been that way their whole life, or they may have lost their mobility, and that in itself is an issue as well.
Now, I'm going to ask you a question.
That also ties into my point earlier, where we'll meet people where they are.
Yes.
People will come to us. We've met people, in schools,
We
at
do
learning
telemedicine.
centers, we do telemedicine. So if somebody can't make it into the office, but they have internet access, we can see them through telemedicine. So we have lots of different kind of
Skype.
tools. Well, we don't use Skype because Skype is not secure. So it's
It isn't
not,
secure.
it's not HIPAA compliant. So we're extremely concerned and cautious when it
Yes.
comes to confidentiality. So we use a HIPAA secure method. It's just like Skype, and it looks like Skype, and it works great, but it's HIPAA secure.
Since we're on the topic of HIPAA, since you mentioned it,
Sure.
what is HIPAA and how important is HIPAA with being a psychotherapist? And because I want this show, we want this topic to be not only for people with special needs and their families, but for people that want to go into the field of psychotherapy. So explain.
Well, HIPAA it's a federally mandated
What is
set of
what
standards.
the acronym stand for?
The
Do you
health
know?
insurance portability and
Accountability?
no, there's
There's two P's.
Yeah. Health insurance portability and protection act.
That would make sense.
Yeah.
So what is?
Yeah.
So in other words, for example, with HIPAA, you guys cannot share information
Yes.
Exactly.
unless
share information.
it's going to hurt somebody, or that person is going to hurt themselves.
We have major rules. So
Yeah.
what you say in our office, it stays in our office. There are exceptions. So if you are going to kill yourself, very obviously we're not going to keep that in the office, right?
Yeah.
We have
So
to.
there are
alert
exceptions to standard
It's like
every
Vegas.
day.
What happens in Vegas stays
Yeah,
in Vegas.
No.
yes, it's almost like that, but not quite.
I'm trying to mean to make light of
No,
because
but we have to smile through some of these,
Yes.
these
Exactly.
heavy situations,
Yes.
right? And we're trying to apply the best helping that we possibly can. So, but there are exceptions. You know, if
Yes.
somebody is expressing and has intent to commit suicide or self-harm, or if somebody intends to hurt someone else.
Yeah.
So homicidal and suicidal ideation, you know, then we are mandated reporters, and we're mandated to help in the best way we possibly can. Sometimes that means contacting screeners. Sometimes it means contacting local law enforcement. There's duty to warn.
now, do you need
statutes.
to be a psychotherapist here in Vermont? You obviously you have to be licensed
Yes.
here in Vermont.
Well, you have to be rostered. You have to have the you have to have a master's degree, and you have to go through the process of being rostered with the state. And on the roster means that you're working your way towards licensure. But you would have to work under someone else's license until you reach that.
In order to bill insurance.
Right.
So you
Speaking of which,
And to
you
be
guys are.
licensed.
Yes.
Right. To be a
Well, you're listed, Jim. You're listed with Psychology Today,
I am.
and
I think we all are.
Yes.
everybody is.
Find us all on Psychology.
And you know there are certain newspapers or magazines that deal with psychiatry and psychology, which is real important to get the message out there. In terms of now, I'm gonna ask a question, and this is like going back when I was a child. When I was a child, I remember, and I'm sure my wife does also, when you're in school and you're getting psychological testing, the WAIS and the WAS exam and the blocks and the certain activities, explain how that would work when determining services with psychiatry or psychology, or and then the second question, are those tests based on a person's skill level, or how are they based?
Boy, I wish we had Sarah
I
White with
know, and I
us.
was thinking that.
Sarah
I'm
White.
sorry.
I can
Yeah, and we can
speak
talk
to
about
that.
it.
Yep.
We'll talk about
Are they
it.
really accurate? Though?
Exactly. Are they
Sarah
really
White
not
is our
rigged,
resident
but
expert.
they're not rigged, but are they accurate?
Are they
Yes.
really accurate?
So the test, when there is a full battery of tests done for a child when they're trying to determine whether they need special services in a school, they are going to be looking at is there a discrepancy between their achievement and their learning, and so they're going to be looking at a lot of domains of how do they learn, what are their capabilities of learning, but then they also want to look at the psychological aspects as well to find out a really full holistic picture of what is going on with this child and why are they struggling in school. Because all of these normed tests, they try to make them as accurate as possible, but every child is an individual. So it's very, very important for the special education team and the psychologist that comes in to do that specialized testing, that they see that child as a whole person.
Like putting pictures in order.
Yes, and not just the score. It's not just the score, it's who are they as an individual.
Yeah, putting, some of the tests would be, or the activities, putting pictures in order, or, or reading a spelling list. And as you go through the spelling list, the harder it gets. Or putting numbers in order. Like I'm really good with adding and subtracting numbers. So, like for example, if I'm given 1, 2, 3, they would have to do it backwards, but then add it and subtract it.
Yeah. So some of the things they're going to be looking at are going to be academic, but some of them are going to be memory, they're going to be spatial learning, they're also going to be looking at your short-term memory and your long-term memory and how do you process. So there's a lot of processing skills that they're also looking at. And then if they did discover that there were some emotional components to the issues that the child was having that was making it more difficult for
children
them to
or
be,
adults or both?
Children or, well, it depends on what you're doing the testing for. This is if you're at school doing testing, but adults can also have all of those batteries of tests as well. If there were some emotional components, then part of that individualized plan may be going to psychotherapy as well as getting whatever else, what other supports they would need.
Do you guys, as far as like services within Vermont, like if someone needs or wants to get Social Security or some other service, okay? Or if someone comes to you and says, oh, I need a psychological test done for, like Social Security Administration requires you sometimes to get psychological testing. Do you guys deal with that?
Not the type of, no.
We would refer that.
We would refer that out.
You refer them to another agency.
Specialist.
Okay.
Or Social Security would have their own resources.
Oh no! I just thought you might have worked with other huge other agencies. Okay. Now, what are the missions? What are some of the misconceptions around people with special needs when you first meet them?
I've actually come across, I've worked with a few adults who have special needs, and I really love working with them. And some of the misconceptions when they come in is that they get really frustrated because people treat them like they're kids. Or like they don't know what they're doing.
Their abilities.
They underestimate their abilities, and they treat them as if they can't independently function or learn how to independently function. So it's almost like they're not a person. They're like a puppet that needs to be taught where to walk, and they get very, very frustrated with that. And so I really actually enjoy working with them on how do you communicate I am independent in a way that makes sense for them.
So like Miss Piggy getting angry, or Kermit the Frog getting angry, or something.
Like if you go to some of these children homes in New York, they treat you like crap because they say, oh, you're not going to do well, or you're not going to succeed. I'm like, why? I'm going to succeed.
Or why can't a person, like some of these Ivy League, for example, psychologically, I know people that have applied to Ivy League universities, and I have as well in the past. You know, and then if a person's told, oh, they won't be able, you won't be able to do it. Why not? Why can't a person? But then I do know also people that have applied to 8 schools and got into 8 or 9 schools. Why can't, psychologically, that goes through a person's brain? I'm as normal as they come. Why can't I apply to a university? I mean, what is your take on those things? Like if a person with a special need is told, oh, you're not going to be able to accomplish something because.
Well, those type of people should be encouraged. You know, anyone with any kind of disability should be encouraged to explore their limitations or move past perceived limitations. Outside of being a counselor, actually, I am a developmental home provider.
Oh, okay.
I do
Would you like to talk
exactly.
a little bit about that as well?
Well, I do exactly that. I help folks to live up to their potential, to find their potential. So I provide a living arrangement which is staffed but allows clients with developmental disabilities to actually practice life skills and practice living on their own in a sort of simulated environment. They have an apartment space that's their own, and
because
they have the opportunity
psychologically,
to develop those skills.
going back years ago, as far as the way institutions were, I did research on Vermont with the Brandon School and New York with Willowbrook State School. Psychologically, with Willowbrook State School and Letchworth Village and other things like that, people died in those situations. With PTSD and all these other things. Living on one's own psychologically, it's important to do that.
Right. Well, in fact, the reason I'm a counselor today is because of some of the pioneers in Vermont in the residential integration of people with developmental disabilities. Pat Frowley and Al Vecchione and the folks that started with resources for community living, which became Upper
Zach
Valley
Hughes of
Service
Washington County, people like that,
Yeah, so who really started that whole, change in Vermont, and after the closing of the Brandon School and all that, and have really helped to make that change in Vermont. And
so you
so
believe in deinstitutionalization?
Oh, I've worked with Upper Valley Services since I was in my early 20s as, a day provider, respite provider, crisis intervention, working as part of the crisis team, and as a home provider now for well over.
So you have people
20
in
years.
your. Oh wait, I'm confused a little bit. You have people in your home.
Oh, so
what
this
is a home
interesting.
provider?
So usually the definition of a home provider would be having folks live in your home. My situation is different. So I actually own a building. It's a duplex. It used to be my home, and it's staffed. So I spend a number of shifts there myself, and then I have other folks who work with me, who staff as respite providers, and I'm the home provider. And the folks that live with me live semi-independently. So they each have their own apartment space, and really they have the ability to function to whatever degree they aspire.
Is it similar to because Montpelier, for example, has pioneer apartments where people with special needs live there. Is it similar to that, or?
So it's different in that it's not it's not a group home in any way, and it's not ran by an agency.
No, it's run. Well, Pioneer
just,
Apartments is run by Montpelier Housing because everybody there that lives there has their own apartment.
Right. So I'm actually a home provider. So I would be there to do med administration, things like that. Help them day to day, sort of kind of in the moment counseling almost, except it's not counseling. It's home providing, so it's a different thing. So it's a little off topic of what we're doing here, what we're talking about today, but it is along the lines of helping folks with special needs.
Okay. Now,
do they cook for themselves?
Yes, my folks do. Of course, if they're, in the past I have worked with folks who didn't have that ability, and we would work to see if they were interested or able to do that safely.
Now, okay, getting back to Lifemap, addiction, okay. Alcohol, and drug addiction. It's a big, huge situation in Washington County. Do you guys? How do you guys deal, or would you count, would you contract out to say AA or another agency to help people with alcohol and drug addiction? How do you deal with that?
I have a high percentage of folks on my caseload who struggle with dual diagnosis. So dual diagnosis is
Explain what that is.
Yep, dual diagnosis is when somebody has a mental health diagnosis and they also struggle with some sort of substance abuse or dependence. Oftentimes, they'll be seeing me for individual counseling, and I'll be able to treat both. We're authorized
Including
to do that.
opiates, and because opiates is a big
alcohol,
thing.
Cannabis overuse and abuse, dependence, prescription medications, so across the board. So oftentimes they'll see me, and then they'll also be involved in another treatment, such as going to Alcoholics Anonymous, or locally there's Refuge Recovery, which is a fantastic program in the area. They'll go to Central Vermont Substance Abuse Services, Washington County Mental Health. So once again, they'll receive services where it's appropriate. We also make referrals to inpatient. So if somebody needs some inpatient treatment, down to the Brattleboro Retreat for dual diagnosis or for substance abuse, or we'll recommend somebody go for detox in Burlington. Or
What is detox exactly?
Detox, well, a medically supervised detox is when somebody goes into a medically supervised setting. That way they can be away from those
methadone
substances.
clinic?
It's not specifically a methadone clinic. So a detox would be coming off of your whatever you've been addicted to or you are addicted to, and being medically supervised.
Some people are addicted to painkillers and they overdose.
Absolutely. Yep.
So none of us on this panel are currently LADCs or LADACs, the
licensed alcohol and drug counselors.
Yeah.
Okay.
However, we do treat the underlying issues which lead to addiction.
For example, what are those?
Many times when someone is seeing a drug counselor, they're referred to us for their underlying depression or trauma history or other issues that have led to the depression, PTSD.
Because oftentimes the substance is what's covering up all of those awful feelings from something that has happened currently or in their past. And so those are the things we're going to be working on, and then working as a team approach with the people that are actually helping them to move away from the addiction.
Okay.
People will come in and say that they were self-medicating. That's one of the common terms people will come in with.
Self-medicating is what?
Trying to cover up your symptoms, trying to feel better through using whatever substance.
Yep.
That's self-medicating.
Yep. Covering up the emotional pain.
It's no good. You can hold it deep inside.
What?
Right.
Oh, since we're holding things inside as far as anger management, if someone needs anger management, I mean, many because I've been to gyms and I've hit the punching bag. I've hit pillows. You know, I've watched The Incredible Hulk. You know, I've seen that. But what, you know, because hitting people is not when you're angry. You know, domestic violence and all of that stuff. Do you guys deal with anger management?
Yes, definitely.
And domestic violence.
In fact, up until the 70s, it was thought that venting your anger was the best way to go, and there was actually a time when they might have instructed people to hit a pillow or something. What research has uncovered since then, though, is that really all that does is create a link between aggressive behavior and the feelings of anger. So it just causes more aggressive behavior.
It doesn't get it out.
And it doesn't deal with the anger. So
you seen that film with Jack Nicholson, Anger Management?
what? So actually, there are some of us that do and have in the past facilitated anger management groups, and I think we've all worked with individuals with anger management issues.
Okay.
One of the things that we try to cultivate in many of our clients who struggle with that is distress tolerance. So being able to kind of have some emotional regulation and being able to handle the distress of feeling angry, right? And then what do you do with it from there? So we, some of us do a lot of practice with mindfulness work. So we'll teach breathing techniques or relaxation or
Yoga.
visualization. Not in our office. We don't specifically do yoga.
We might
but
recommend it.
We might recommend it. And there's plenty of yoga, fantastic yoga studios in Central Vermont.
Zumba
so-
classes.
If Zumba works, absolutely.
You know, about used to get mad every time somebody, you know.
Stretching and exercise is amazing for
No,
reducing
I'm going to
stress.
ask you this question.
Deep
Well,
breathing.
being a psychotherapist, this is an opinion question. Television and media deals with challenge, people with mental and physical disabilities on television, right? Sometimes the way they portray, the way television media portrays people with a mental challenge can go off the cuff sometimes. What is your opinion on that? And being the fact that you are a psychotherapist, maybe you could shed some light on how media treats people with disabilities. Bad, indifferent.
Well, there's always a degree of sensationalizing, using that for ratings or as a plot device in a program, and that's really unfortunate. There was the recent 13 Reasons Why, which was not. Although in some ways, it might have had some accuracies, and it might have been helpful for some folks. It was also not so good for others to watch, and might have
like The Good Doctor, for example, is about a doctor with autism. There are certain mannerisms with autism that are portrayed in that show, but then there are those that are sensationalized. Autism is one of those things that is not explained.
Right.
Which you've dealt with autism, correct?
Right. Yes. And then there are movies like A Beautiful Mind, which
Rain Man.
which illustrate. Yeah, definitely. There have been some good movies that help the public to understand what others are going through, and it just depends. It's a mixed bag, I think, when it comes to media.
Yep. Sometimes when I find when I'm first meeting a client, I'll ask them if they have had any therapeutic relationships in the past, if they've gone to a therapist, and if they haven't, I say, well, what do you think therapy is about? Because sometimes they've gotten some their ideas are skewed by what they've seen on TV or the movies, so we kind of have a talk about what do they think is going to happen in therapy, and then we can talk about what actually might happen in therapy.
So if someone comes to you,
like for example, analyze this and analyze that, as soon as you see that picture.
Right, right, yes.
or one flew over the cuckoo's
Yeah, I was actually just about to say something about that.
Yeah, coming in for that first meeting and asking, oh, should I lay on your couch? Or
Yeah.
should I sit? How should I sit?
Oh yeah, tell them about the couch.
Right? So,
And I don't have a couch in my office, so the clients go, well, now what am I
How
supposed to do?
How does that make you feel? Okay, well, yeah, we should make light of certain things.
And we laugh a lot.
Yes.
Yeah.
I don't think I've ever gotten through. I mean, there are some really serious, painful things that people are going through, but then sometimes it really is healing and freeing to just be laughing at, not making light of what's going on, but really being a team. We're working together to see where do you want to go, where you're looking for hope, and realizing that you can have a range of emotions even when you're going through a difficult time.
Couples therapy, right?
I love it.
If a couple comes to you guys and says, okay, we're trying to have a child, but we're having difficulty and we can't, and we want to adopt. Washington County, they have lots of adoptions, but certain agencies might not, like if a couple's disabled, but they feel that they can adopt a child. How would you counsel them, for example?
Well, I feel like it wouldn't be our place to judge or determine if they could or they couldn't. The real issue in that would be they've just had a pretty big loss. your future was based on you were planning to have a baby together, and you had to replan that into adoption, which has its own sense of challenges. And that's where we would focus on, would be that area, not in making a determination if, yep, you'd be great parents or not. That's absolutely not what we do. We would talk through, what do you think this would look like?
It will be helping the couple to organize and to kind of sort out how they feel.
Yes.
Right? That way they were empowered to make the right decisions for them at the time, trying to give them clarity, help them to kind of work and cope with that sense of loss.
Yep.
Yeah, well, if someone loses a child, that's another type of therapy. Well, bereavement.
We do
Yeah.
bereavement
Grief
counseling.
counseling.
Yeah.
Well, grief counseling. Grief counseling. Someone loses a relative, you know, which is a big thing. Now, here comes the fun part. Pros and cons of being, well, okay, it's a job. It's a thankless job.
I don't know.
There's plenty of things.
Pros and cons to be, because like I said, I want this to be not only for people with special needs and their families, but for people who want to go into the field. Pros and cons of being a psychotherapist.
Of being a psychotherapist.
Like things you like, things you dislike.
Well, as I was saying, I was a teacher for 30 years, and then I got my master's in mental health counseling, and
So you have your master's in teaching and
yes.
you have
and,
2 masters.
Well, no, I have my bachelor's in teaching, and then I have my master's in mental health counseling.
Okay.
And so coming from the teaching field and going into mental health, I am really enjoying this aspect of coming alongside people and working with them. Probably the hardest part is making sure that I set healthy boundaries for myself, and I have to make sure that I practice good self-care and that I can't take the issues that my clients are having. I want to come alongside, and we're going to work as a team.
Setting boundaries.
But I can't do more work than they're doing, and I can't take their grief and their pain into myself. I have to make sure I set good, healthy boundaries so that I am working with them, but not doing the work for them. Because then I will burn out very quickly.
I think
Before
Gary Gordon, one of my mentors, people I worked with for a very long time, would say that we don't heal anybody. You know, we help
You can't heal everybody.
People work on themselves, and we're part of that walk with them when they do it. So we have to keep that in mind, and that's part of maintaining healthy boundaries for ourselves.
Pros and cons on your...
Can I circle back to something that you asked earlier?
Yes, sir.
So HIPAA stands for the Health Insurance Privacy and Portability Act.
Bam, there we go.
There we go. There we go. Your opinion on
The
pros and cons?
Pros and cons. Oh, well, it's
Things you hate. Well, not hate, but dislike.
well, it's the type of job that if you didn't like it, you wouldn't be doing it.
Yeah.
Because it is a lot of work, but it's satisfying work. You're helping people change their lives, and
people automatically
it's
think,
important work.
okay, I'm going to work in the field of disabilities, but I'm not going to make a lot of money out of it. It's not a money-making situation.
No.
You know, it's something you love and you want to help people.
that isn't the proper motivation for getting into counseling.
Exactly.
You know,
What loving and helping people.
Yes, but not to make money.
No, no.
You want to get into counseling because you have empathy for people. You know, maybe there's a large theme with counselors is the wounded healer. You know, a lot of counselors have gone through things in their own lives, and they've had someone help them, perhaps, and they just want to, you know, sort of pay that forward and help other people. So.
Okay. Future goal. We only have a couple of minutes left. Future goals of your agency. Future goals of Lifemap, or you guys as individuals.
Question for the director?
Question for all of us. I think we all have individual goals, and then we have collective goals. Some of us are writing. We've got a couple of book projects happening right now.
You're in a band.
Well, yeah, but that's I keep that separate. Although I have done counseling with music sometimes, so some clients will bring in guitars, but that's a whole nother sidetrack. But so some of us are writing. We've got some initiatives going on. We're partnering with some local businesses, doing some support for their employees. We're also expanding our services in schools, so we're working on that piece.
Oh,
So-
speaking about, real quick, to backtrack, when I was in New York, I was working for a hospital. They had something called EAP, Employment Assistance Program.
Yep.
Let's backtrack a little bit since you said employees.
We partner with local EAP agencies, and
Yes. Explain what
they make
EAP really is.
referrals to our agency. So there'll be an employee who's covered by EAP through a certain company, and then the referral will come in and we'll see them just for normal counseling. Typically EAP will pay for counseling for a couple of sessions, up to maybe 5 or 6 sessions, depending on the EAP. Sometimes those folks will come in and do the work that they need to do, the clients, and then they'll move on. Other times they will transition and
Because
stay on
we're
with us.
public access and we can't mention money on this program,
Yeah.
but you guys take most insurances,
Yes.
right?
Yep.
Medicare, Medicaid.
We take Medicare. Well, we don't. We have one clinician who can take Medicare, so we do. We take TRICARE, MVP, Blue Cross, Cigna,
United
Now,
most
what
major
if-
insurances.
What if
except-
someone really needs counseling, but cannot afford it?
We'll do
Because it-
sliding scales for folks, or we will refer to one of the larger agencies, like Washington County Mental Health. So it really depends on the circumstance. Our view is that we want to kind of bring down barriers to treatment. So we'll talk to folks and see what's right and what's appropriate for the person. We meet people where they are.
Okay. Well, anything else you want to add before we end?
I think you were talking about stigmas, and sometimes people have gone to a therapist that really wasn't a good match for them.
Yes.
And I really want to let people know that they should try someone else. Don't think all therapists are like the person that they were not a good match with, because even within our 7, all of us have very different personalities, and although we're all in the helping profession, your personality may not mesh with that person's style, but another person may be perfect for you. So don't give up and try to find the right person that's going to help you to reach your goals.
And it truly is a gift to help people get there, because you meet folks that you wouldn't ordinarily meet, and you sit with them at their worst. And that's such like a rare thing, because most people put up that strong front, and so we get to
Or putting up a wall.
Yes, and so we get that gift of when somebody comes in and talks about something really like deep, I see it as like this huge present. And it's just such an honor, and it's so humbling to sit in the presence of folks who have survived so much and are still sitting there.
Yeah, gaining that trust.
Yeah.
Yeah. Last question though. Yeah, since we mentioned gaining trust, how do you gain trust? The trust of somebody when you first meet them, because being a psychotherapist is hard.
It's about having a relationship. It's about having a professional helping relationship. It's exactly what we're talking about. You know, it's establishing what would be professionally called a rapport, but really it's just, do you have a relationship with that person? And sometimes that can happen very quickly. Other times it takes time.
Takes time.
Yeah.
Yep. Yeah.
And that's okay.
Yeah.
Okay.
That's absolutely okay.
Well, I would like to thank you guys for joining us. Do you want to ask a question? Okay. I would like to thank you guys for joining us on this edition of Abled and On Air. This puts an end to this edition of Abled and On Air. I'm Lauren Seiler.
I'm on the side.
See you next time.